Hi everyone, Dr. Nemechek here. I want to discuss about one of the ways you can essentially prove you have bacterial overgrowth or SIBO. All right. Now, I discuss it as the bacteria in the colon living in the small intestine. And so I've got like the bird species in the small intestine and the fish species in the large intestine. So when you get overgrowth, and typically in adults it's one, maybe two species, that's called SIBO. Small Intestine Bacterial Overgrowth, SIBO. All right. Now, there's breath tests that you can do that can give you a result, but they're so inaccurate, I don't use them. Okay? I mean, 20-30% wrong. And people will do these stool tests with a rectal stool specimen, cannot tell you that you have bacterial overgrowth. I'm sorry. I know some of these labs are saying that. You cannot do that. All right? It's not my opinion. Research says you can't do that. It doesn't work. So then how can you tell? Well, if you get a positive response after you're taking Rifaximin. So Rifaximin is a specialized antibiotic. You do not absorb it. Bactrim, so you got birds and fish. Bactrim only kills fish, but it only works where the birds are. So the only thing it could do is reverse that. All right? And they've used Rifaximin for this for 30 years in patients with advanced liver disease. It's a condition called hepatic encephalopathy. It's worldwide. It's the single most common use for this medication. Now, so if you take a round of Rifaximin and you're like, wow, this digestive stuff got better, or my anxiety dropped all of a sudden, or boy, my brain fog just improved some. If some things change within that week or two, you had SIBO. It's the only thing it can do. The drug can't get in your bloodstream to go do something else. All right? Now, what if you take it and you don't feel that? Doesn't mean you don't have SIBO. All right? You got to wait a little longer, see if things are improving. But if, and I would say it's 75-80% of the patients will notice something positive within the first 2 weeks. If that's the case, you definitely had SIBO. And don't let anybody tell you otherwise. And if it doesn't work, you have to look for either wait longer, see if it starts working then, after that, especially if you're doing the whole protocol, it's around that third or fourth month, you're going to really start noticing improvements. And if not, then you have to look for a secondary source of leaky gut, and that might be COVID. And you can see I've got other videos on that. If you're having trouble sorting this all out, a lot of patients will fly out to Arizona for their first visit, and then we can do, telemedicine visits. We do that about every 4 months for a year and a half. Usually by 12 months, most people are fixed up pretty good. They've recovered a great deal, and they don't need me anymore. So it's usually one visit to Arizona and you're done if you can't get somebody locally to help you. All right, everybody, have a great day. Take care now.